Hey, good afternoon, everyone. Good afternoon. I am Marek Calhoun, Director of Social and Community Services with my partner in crime.
I'm Daniel Myers, MATHD Program Director for CareSouth. Yeah, I'm just glad to be here, bro.
Yep. And this is the Care South Carolina Community Live podcast. This is the last podcast of year 2020. Yes. And we wanted to go out like we started, just me and Daniel. We started the podcast. The first show was just me and him, so we wanted to end the year off with just me and him, and kind of
Yeah,
yeah, right,
yeah,
yeah, and just kind
yeah.
of a year in review of kind of what we touched on some this year, and we also wanted to leave you with some good safety tips for the new year, bringing in the new year, and then we want to kind of end with um, some a preview of what we may have in store for 2021 and some of the dynamic
Mm.
guests we have on the show that we're going to be reaching out to and see. Okay, but yeah, it's been real, right, bro?
Yeah, man. It just started out as just an idea. You know, what would happen? Where would it go? And then all of a sudden, we found a passion, something that we love, and also something that's beneficial to employees and our community. Man, never thought. I mean, I just need you to tell everybody the kind of response that you've been getting from people not even in our area about what we're doing.
Absolutely. And being on Facebook, you kind of get an opportunity to meet people literally all over the world. And we've had individuals from definitely different states reaching out and sharing some of the podcasts that we put out there. And I recently had a gentleman from Erie, Pennsylvania, Anthony McGowan, and he's a fellow Raiders fan. That's kind of how we met in kind of a Raiders
Mm.
group. Go Raiders, and and I had an opportunity to kind of get on a live with him in one of our groups, and we were just talking, football, of course, and the collapse of the Raiders at the end of the year after starting about 6-5, and then we're probably going to end up 7-9, and but at the end of that live, he kind of shouted out the podcast and kind of what we're doing and the message that we're trying to get out. And he gave me an opportunity to also kind of promote the podcast there a little bit and talk about what we do and why we did it. If many don't know, the kind of the reason why we created, like he said, it started with an idea, but what kind of the catalyst for that was the pandemic. Daniel and I and now his staff and my staff, we're kind of responsible for doing community outreach for Care South Carolina and getting out in the community and talk about the programs and services that we have here at Care South. And because of the pandemic, we kind of pull, because we want to be safe and make sure staff is safe and the community is safe, we pull staff back out of the community and didn't really have an opportunity to do outreach like we want to and promote some of the programs. So we started putting our heads together, like, what can we do? And hey, Rena, how you doing? Yeah, thank you. You're the
Hey,
MVP too. We
that's
had you
right.
on the show. We definitely had Rena Dixon on the show, and Fact Forward. They're doing a lot of work with teen pregnancy. One of our many community partners, one of our most active
Yes,
community partners that we're active with. We appreciate all the work you guys are doing over there and over at Fact Forward. And but
that's right. Dr.
um,
Dixon, right? Is that Dr. Dixon?
Dr. Dixon, that's it, man. But yeah, we definitely and so we had put ourselves together, heads together, and said, what can we do to get the word about some of the programs and services that CareSouth have, that we were doing before out in the community. So me and Daniel was like, you know what, something me and him kind of individually thought about having creating a podcast for CareSouth. Me on more of the community side, and him more on MAT and SUD substance use side, and so we decided to kind of join forces, and hey, it was born CareSouth Carolina Community Live Podcast, right? And
Yeah, that's it.
yeah,
Yeah.
so and here we are, almost I think our first broadcast was in June or July, maybe.
Yeah.
So here we go, 6 months
Yeah.
later in the year. We're still rolling, and I think the podcast. What you think that it's been beneficial for folks. I think getting the word out
Yeah.
and information.
I think it's been beneficial.
Yeah, absolutely.
Yeah.
Yeah. So hey, how
Hello,
you
Miss
doing,
Tamika.
Miss Tamika? How you doing, classmate, high school mate, rather? All right, and married to Cormlet, one of the best real estate companies in the state of South Carolina. Exit Realty down in the Hill
Oh,
Country. Yeah, shameless plug for you.
yeah.
And but some of the guests. Remember, just thinking back, some of the memorable guests that we've had. Man, the first starting out with you in that presentation that you did on Narcan. That kicked us off. You know what I mean? Yes, there you go.
Right.
There you go. There you go with
Right.
Narcan. Yeah, that
Mm-hmm.
started the whole thing. The desire to get that training out there, and from there, we were able to. Our actual first guest, Dr. Jonathan Davis, right? And
Yeah.
she's
Dr. Davis. Dr. Davis, Bone Thugs and Harmony. Dr. Bones.
they tell them why you call her Bro Thugs and Harmony.
Yeah, because he's a chiropractor. He got his two group members there with him, Hillary and Van, and now they added a new one to the group. So since he's Dr. Bones, he had to have his group with him. So I call him Bone Thugs and Harmony. So because they make music happen back there in Cairo. That's why.
Yes,
So
absolutely. They're definitely doing some good work in Cairo. And making a difference, man, healing people through chiropractic services. One thing we learned from Dr. Davis that your spine, it affects almost every part of your body, from your organs to other bones and systems in you. I didn't know that, and he really educated me in his services, and being able to use chiropractic services to address chronic pain, substance abuse, and many other ailments.
yeah, definitely.
And then we kicked it off with, well, actually his sister was second, right? Amy.
Yep.
Davis Cook,
Behavior health.
yeah, behavior health. Some of the most memorable, like I said, guests that we've had on the show. She definitely was one as well. And
Yes.
one of the other things we tried to do was kind of bring on some of our community partners, like we said earlier. We had SC Thrive on, right?
Mhm.
Yeah, they do a
Man,
lot
we
of
had man to man.
man to man. Yes, we had man to man doing some great work
Mhm.
with the fathers here in South Carolina. Um, and most recently, we had the street, um,
Street, the dope doctor,
the dope
Mr.
doctor.
Louis
There you go,
Delgado.
Louis Delgado. Yeah. So
Yes.
and one of the most popular ones, couple that we've had, started out, Miss Ann Lewis, and for
Mm-hmm.
Community Health Center Week. She came on with one of her fellow CEOs, Miss Carolyn
Yes.
Emanuel, and they talked about the history of community health centers, and why community health centers are important, and play a huge role in providing health services here in not just South Carolina, but throughout the nation. Right?
Can I say something about that one, Marek? Whenever Miss Lewis came on, Miss Ann came on, her and the other her and her friend that came on, I was humbled by that podcast, because I was in the presence of greatness, a bunch of wisdom, and just class, and I was just in awe of all of that. So that really, it taught me a lot about the history of healthcare centers, but it also taught me that how passion don't just start here today, and then passion goes on and on. And so just CareSouth in itself, having 40 years now, it's still a passion to Ann. It's a passion to our CEO, and I mean that's amazing to me that you can love it just as much now as you did when you first started. You know, and not to mention all the innovation that she's allowed us to partake in, making CareSouth grow into something that's beyond the walls of CareSouth, all the way out into the community. Even now with the mobies, even with telehealth, telecommunications, behavioral health, and also telecommunications using our behavioral health counselors as well. So CareSouth is, I mean, we're not up and coming. We are the top. And a lot of people got to come ways up just to get to where we are right now. Now I'm tooting our own horn a little bit, but I can afford to do that because I know how great we are, right? So
that's right.
Yeah.
That's right. Absolutely. So it definitely been a year. You know, we've had Dr. Duncan on here twice.
Yes.
Yeah, twice. You know, discuss population health and how it benefits not only Care South Carolina but our patients overall. We've had her back talk about the new EHR system that we're currently implementing. I think we're in like week 2 or 3 of implementation.
Yeah.
We're through.
Yeah.
And
it's
going well. You know, we've had some growing pains.
Yeah.
We've had some growing pains, but we're learning the system. You know, the previous system we were able to be hands-on. The trainers were able to be here hands-on, and some of our trainers were be able to be hands-on, but because of COVID, we're having to do everything kind of remotely, and it's been a little different. It's been a little different, but we're weathering the storm, and each day is easier than the previous, right?
Yes, right. That's right.
Mm-hmm. Yeah, go ahead.
I'm sorry. You know, we also want to thank the ECW staff who made themselves available for us even during this transition. You know, being there live so we can call them and actually have somebody that we can talk to talk us through the process. Even though it was a little frustrating in the beginning, I can see everybody's kind of mellowing out. And the one good thing, Marek, about this is that we never lost a patient through all of this.
Right.
Our patients were patient. They were patient with us, and our staff, you know, they were champions. And even in the midst of adversity, they prevailed even over that. And so our patients still got the best service that they can get anywhere. You know, so hey, another thumbs up to CareSouth.
Absolutely. Yeah. ECW training staff has been wonderful. Our consultants at Blue Nova have been great as well, guiding us in the direction and connecting us and making sure there's a seamless connection between us and the ECW trainers. It's definitely been a wonderful ride so far, you know, and like I said, each day gets better than the previous. So we're still working at it. And we're definitely going into 2021. We're going to look to kind of improve and learn more about the system and as we move forward.
That's right.
And I think back, and we've had Dr. Smith on a couple of times to talk about MAT, and most recently talk about the vaccine, as well as Dr. Jan Kelly, State's Sister Epidemiology, talking about the vaccine. Some of our most recent guests to the podcast.
Yes. You know, and Marek also, you know, Dr. Smith with his transparency, you know, when he went through the actual, when he had COVID, he actually going through the process of healing, and how he was so transparent, let everybody know exactly what he went through to try to, you know, prevent somebody from going through the same thing by being careful, by being cautious, by taking all preventative measures. Also, he talked us, you know, in depth about the validity of the vaccine, and how we shouldn't, you know, question how quick it was made, you know, and you know, the process in itself, everything is safe. But he still wanted everybody to make a decision, an educated decision, and a conscious decision, having all the information that you need, and not all the hearsay and all the hoopla and all the myths and theories and conspiracy theories. So he came up with true facts, and I hope everybody listened. If you missed it, go back and watch it because it's still on there. Go back and watch Dr. Jane Kelly and watch Dr. Smith, and get some information on these things, you know, on this vaccine.
Absolutely. And as we roll into 2020, we definitely want to maybe have her back and maybe have him on and just kind of give us an update as we move on, because you know, hopefully once the New Year's get in, you know, more and more the vaccine will be out there, including our own staff who will have an opportunity to um, get vaccinated, and then as the year rolls on, be able to start vaccinating the community as well, those who want it.
That's right. That's right.
Yeah.
That's right. That's right.
So it's definitely been a memorable year, man. I definitely enjoyed it, man. It has definitely been a memorable
Yes.
year. I'm looking forward to 2020. It's kind of bittersweet because even though it's been a good year for the podcast and some of the guests we have, I'm ready for 2020 to just go. I'm ready
Yes.
for
Definitely.
2020 to go, and start fresh 2021 with good hopes of ending this pandemic and people getting healthier and this virus being in our rear view. So, like I said, a little bittersweet, but I'm just ready for new beginnings.
That's right. And Marek, on that note, I think it'd be fitting right now that we take just 5 seconds of silence just in memory of those that we lost to COVID-19 within our CareSouth family and within our extended CareSouth family, into our communities, into the nation, into the world as a whole. Just 5 minutes, just to honor those that lost their lives in this battle.
Absolutely, absolutely,
Wonderful. So just keep those people in your prayers, keep those families in your prayers, and let's continue to fight against this thing. Let's continue to be safe. You know, every bit of information that we brought you was indirectly indirectly related to COVID-19. Everything that we brought you, it was a reflection on what we was dealing with worldwide. Even though we saw it here first in our community, we saw it in other people's communities as well. So we just need to be mindful and vigilant about what we're doing in the coming days, in the coming hours, actually. So,
absolutely. But one of the other things that we wanted to touch on today was, we want everyone as we go into the new year to have a safe new year, right? Have a safe new year, even when it comes to COVID, when it comes to, sometimes New Year's, what we know that New Year's and the holidays bring on certain. Hey Sam, how you doing? Bring certain anxieties and bring on certain feelings of depression, and sometimes we deal with it in different ways, right? Sometimes those ways aren't always the healthiest way of dealing with it. So, with my partner crime being a nurse by trade, health being definitely his forte, and being a director of MAT in our substance use disorder program, I wanted to defer to him and see if he can just give us some pointers, some tips, some things that folks can go into for themselves and their families and friends to be safe over the new year as we cross over into the new year.
well, we understand that the celebration of New Year's usually involve alcohol, and it usually involve, and I hate to say it and I cringe every time I say it, but it also involves some people using illicit substances, and we kind of talk against both, but if you're going to drink, please drink responsibly. And if you know somebody that's dealing with any substance abuse issues or anything like that, that's struggling, if you're struggling, and everything is done in anonymity, and we keep everything safe, we keep everything confidential. And feel free to contact us. We got a contact card that we're going to put on the screen right now for you to look at. You can get these numbers off of here where you can contact, call any office number, any of CareSouth office numbers, and they'll put you in touch with the on-call provider. Also, there's a contact card. My number's on this contact card as well, where you can contact me and I can put you in touch with the right agency or give you some more advice on where you need to go during this time. But CareSouth is here to help you with any of your substance abuse, MAT service needs, any behavioral health needs, because they go hand in hand. Elaine Carroll, who's our coordinator, she has set you up an appointment with our day orders agencies, and in turn, put you with one of our MAT providers here at CareSouth. We really look forward to assisting anybody that's going through anything. So, like Marek said, during this time, there's a lot of depression, a lot of anxiety. There's a lot of things going on in our minds, and we want to self-medicate. Let's try not to do that. Let's try to seek help. If you need information, please reach out to these numbers listed right here on the screen and contact somebody. Let us know what you need, and we'll be really uh, honored to help you. Really, I mean that with all my heart. Um, we got some good providers. We got some good partners with our Deotis agencies, and we'll do everything we can to get you the services that you need. Um, and also, in light of all the overdoses that we've had this year, as related to the pandemic, we, me personally, I've lost family members to overdose. I've lost friends to overdose. I've lost neighbors to overdose. It's personal with me. And so, and just in recognition of them and trying to get the word out about the new substance, not a new substance, but the substance that's going around that's killing people, the fentanyl. Me and Kirsten Fornash designed this billboard, which is up right now in Dillon, in front of the dialysis center, and it kind of gives you an idea of what we're dealing with in the streets when it comes to substances. We use a dime right here is used for for a relative measure on how much it takes to kill a person. Heroin, fentanyl, and carfentanil. And if you can look at the size of that, it don't take a whole lot. And we have a whole lot of people that's overdosing and dying because of these substances. So if you know somebody that's dealing with this or using these substances, please reach out to us so we can get them help or refer them to us. We want to save a life. The question at the top of this billboard is how much is too much? We don't know because we don't know what's in the drugs that you're using. But we want to keep you away from those drugs and get you into services, into treatment, into behavioral health modification, so we can get you onto a smoother path of life. That your 2021 will be a whole lot better than your 2020. So allow us to be that service to you, please. And if anybody that needs Narcan, or if you know a person that's on drugs, that's have substance use disorder or alcohol misuse disorder, please send them. Let us know so we can try to get them in their hand or give it to a family member, because this right here will save a life. It will save a life, trust me. And so don't hesitate. There is no side effects from Narcan other than opiate reversal, but it can save a life. So just reach out to us and let us know what you need. And we are community distributors, and as long as supplies last, we'll be more than glad to give you a dose of Narcan to help save a life. So while you're out this weekend, be vigilant, be careful. Wear your mask. Celebrate. If you're gonna be in a group, wear your mask, cover up. Remember Rick already talked about using the gaiters. The neck gaiters are not good. If you're gonna use a neck gaiter, have another barrier there. So wear a mask and wear your decorative neck gaiter so that you can help protect yourself and protect those around you. We don't know who got COVID. You can't look at a person and say they got COVID or not. So we got to assume that everybody has it, just like universal precautions. We have to assume that everybody has something and treat everybody like they're infected. Not that we want to be bad, but we want to save lives, and we want to keep our families healthy and keep our work families healthy. So let's use caution. Let's be vigilant. Let's just be smart, everybody. If the government says gathering, please, you don't have to prove it. You don't have to put it you're a tough guy by saying I'm gonna just be, vigilante or whatever you want to call it. I'm a gatherer because I'm not listening to nobody. I'm gonna do what nobody tell me what to do. Okay, maybe they don't tell you what to do now, but when you get sick and they tell you to turn over and lay on your stomach because you can't breathe and your lungs won't fill up, you will listen to them. So before we get to that point, listen to the preventative measures, please. Okay? I'm done, Marek. I'm finished.
Absolutely. I appreciate that. That was some good information for sure. That's some good information for sure to take into the new year. Like you said, we just want everyone to be safe, whether it's wearing your mask, practicing physical distancing, hand washing, good hygiene, as well as being safe from substances. Not, again, party in moderation, but don't drink and drive.
Exactly.
No illicit substances, but if you do, contact Daniel. We put the contact card up. See them about getting some Narcan. Narcan in every hand has been the slogan, and what Daniel and his group and what CareSouth has been pushing, and some of our partner Deoda's agency has been pushing from day one. Narcan in every hand, because Narcan will and can and will save lives, and
Yes,
that's very,
definitely.
very, very important. We've I haven't personally seen it, but at CareSouth we've had to use it, on someone that we came across that was overdosing, and it saved their life. So we hear stories are shared with us all the time of how Narcan have saved lives. Law enforcement, our first responders carrying Narcan. We want to make sure that they have a Narcan in every hand, so they'll be able to respond to instances where they may be able to save a life as well. So, like I said, we definitely want you to go into the new year, safely, and refocus, because 2020 has definitely been an ordeal, and going into 2021, we want it to be wonderful. We want it to be great, and we wanted to kick off 2021 better than we did in 2020. Right? I see some good days ahead. I really do.
Yeah. But hey, main thing is buy 2020. Buy. So long, 2020. Good riddance,
Bye.
2020. I have
Take the
never been
ball.
glad to see a year go.
Yeah.
You know what? I don't even want nobody to give me a $20 bill. Don't even give me 2 tens. Don't even give me a 20. Give me 2 tens. Give me 2 tens.
2 teams. Okay. All right. All right. I can deal with that too. So we're gonna take 2020 and do like Uncle Phil used to do, jazz and Fresh Prince. We throwing it right on out. That's it. So that's how it is. But definitely, as we wrap up, we want to kind of talk about what's ahead for Care South Carolina podcast for 2021. Be on the lookout, because we may come back. We're definitely going to come back with a new look
Oh yeah.
with our podcast. We're going to give it a little makeover, a little remodel, and come back with a new look, and hopefully some more bells and whistles. That's the goal, at least for 2021, and that actually kicks off next week. And
Yeah.
if everything goes right, for 2021, we got some great dynamic guests that we're going to reach out to, that we're hoping to bring on one of those guests at some point. Hopefully, it could be next week. We don't know. Don Strickland over at PDRTA. Man, Don and his crew over there at PDRTA have been some great community
Yes.
partners. They've worked with us, and they've worked with counties and cities and industry to bring much needed bus services to many of the service areas that we cover here with Care South Carolina, and Marlborough County, Dillon County, and Darlington County. So they've worked hard with us, and they've been a godsend. Some of our community partners have come together into that process to help bring much needed bus services to the PD region. So we look forward to having him. Truth be known, I'm trying to get him for next week, but we got to make sure his schedule jives with us. Don, if you're out there. Some of the other areas. What are some of the other areas that we're looking to bring in?
We're looking to bring in a lot of our law enforcement. A lot of our law enforcement departments have new heads, and so we're trying to bring them in to give us an update on what they plan to do for their counties. Especially in the area of drugs, and rehabilitation and everything like that. We're also looking to bring in a lot more people. We have a lot more departments in CareSouth that we need to cover. I'm just throwing it out there. I hope Denise don't get mad at me. I love you, Denise. Human resource. Hoping to bring human resources in. Hoping to bring our nursing department in. Hoping to bring in our recruitment and retention personnel. Miss Harriet Parker. Am I right?
Yep.
I also hoping to bring in Mr. John Douglas, who our business, talking about the CareSouth business and our partnership with those stakeholders and people out there in the community that CareSouth is partnering with. We hope to bring. It's so many people. Right now, me and Marek we probably gonna do a podcast every day. But it's just that many things that we can bring to you. But everything that we're bringing, we want it to be beneficial to everybody that's viewing it. So
Absolutely, absolutely. Like you said, we got many other sources. Our community health, Joe Biddle, he think he's out of the woods, but I'm going to
No,
grab him as well. We have a IV infusion lab. We want to
sure
talk about.
do.
Yeah,
Mhm.
we want to talk about them, and it's just so many other programs and departments and programs and benefits to our patients and those in the community who, especially those who may not have a healthcare home. We have a home here for you. You know, we have a lot of services under our roof. We practice
Mhm.
an integrated um, model of medicine, which means I call it the one-stop shop. I tell everybody we can walk in many of our centers, and you can go and you can see a family practitioner. You got the kids with you. We're gonna walk you down the hall, and we're gonna see the pediatrician. After we leave the
Mhm.
pediatrician, we're gonna take that prescription over to the pharmacy that's next door. And once you leave in the pharmacy, you tweak your back a little bit. We got a chiropractor there that we can refer you to. That's part of CareSouth as well. And while you're in the chiropractic table, you decide you have a little sweet tooth and you need some dental work. Well, guess what? We got a dentist and some dental services that we can provide for you. Um,
That's right.
it's just
And,
so much that CareSouth has, right? We can help
yeah,
you
the
get
bad thing is,
medication. Huh?
say it again. Say it again. Say it again about the sweet tooth. What about the sweet tooth again?
You get a little sweet tooth from eating those sweets and those sweets from over the holidays. We have a dental program, not that you can go to that benefit the schools that are in the schools, out of the schools that can fit you. We have a agriculture farm worker program working with the farm worker community that we can assist to get them the farm workers in services, medical services for um, definitely relatively little to no cost. We have services that we can assist patients with medicine and getting those medicines in our pharmacies or some of our community partners at little to no cost. So it's just endless programs and services that Care South Carolina, telehealth, our mobile roads unit, our mobies, just just different programs and services that we have available here at CareSouth that could definitely make a difference in the lives of you and your family.
That's right. And Marek too. Not and I guess I'm kind of partial to this department. I'm kind of
Yes.
biased to this department. But
Okay.
during this time we deal with a lot of anxiety, a lot of depression. So we have behavioral health here as well. There's
Absolutely.
the suicide rate has gone up. You know, to this probably possibly because of pandemic, and also because of our substance use. So let's please seek help. It's okay to talk to somebody. If you know somebody that's going through something, talk to somebody. And our behavioral health counselors are here to serve you in any capacity that they can serve you in. If they can't do anything for you, they know who to refer you to. And I like to give a shout out while I'm saying this to my supervisor. One of the greatest supervisors in the world, Miss Elizabeth Kirshner, who is the director of behavioral health. I think it's got me a day off. I think it's got me a day off, Liz. But please come by and see us. We got everything you need, right? Like Marek said, up under one roof, everything is right here.
Yeah, under one roof, and like I said, we can refer you. We have different areas that if there's a need, we can refer you to, and we got community partners and good referral partners that if something here that we can't handle, we can refer you out and work with them to get you referred out and get the services that you need. So for your healthcare choices, just think about us. Give us a ring 866-498-0399. Check us out on our website. It's www.caresouth-carolina.com or reach out to us on our Facebook page. Look at some of the services that we have to offer. Not taking anything from primary care, but we're more than primary care. That
That's
probably
right.
I wouldn't say it need to be our slogan, but that's we're more than primary. We're more than primary care. We're much more than private practice, and we have
That's right.
not just trying to definitely trying to toot our horn, but not trying to brag. But we have a lot of services that will be beneficial to a lot of people.
That's right. That's right.
Yep. Yep. So
Yeah.
with that being said, I think that's it for us, right?
Hey, yeah,
2020.
man. 2020, but so long. I can't say we had a good time, but so long. And good riddance.
Good riddance.
Um,
That's it right there.
yeah,
Good riddance. And we definitely
but
will
I'm
see you
optimistic.
again. Huh?
I'm optimistic about 2021. I'm optimistic.
Yeah.
You know,
Yeah.
very
Yeah, we
optimistic.
definitely got some big things coming in 2021. And I didn't we didn't talk about this. We have a new center opening on January 12th in Chesterfield. The new building in Chesterfield. Little over I don't want to be wrong. I want to say 10 or 12,000 square feet. I don't want to be wrong, but it's a large building and it's a
Yes,
new
a big
building.
building.
The building that we're in right now will probably fit in the one section of this building right here. So it's going to open up a whole lot more services that we'll be able to provide in the Chesterfield area because of the opening of this new building, state of the art building. To
Yes.
be honest with you, it will have a pharmacy on the inside, so you won't have to go anywhere for your pharmaceutical needs. You can get them right there um, as you leave out for your appointment. There's a lot of good things, a community room where we'll be able to work with folks and maybe do some healthy cooking demonstration, give some classes. Certainly once the pandemic is over. So that building got all the bells and whistles in it. It
Yes.
does.
Yes. Yes.
And we look forward to having the similar building where?
In Dillon, South Carolina, right up the
Yes.
road right there, right down there from me. And
Right down.
also, Marek, right down there from me. Also, next month, we're hoping to bring in the new provider over at our Dillon office, Dr. Carrera. So we're looking
Yes.
forward to seeing her on next month, beginning practice right over there with Samantha Willard over there in Dillon.
Absolutely. Oh yeah,
That's right.
absolutely.
So
Yeah, we definitely we will have a new provider to welcome, new building opening, another building hopefully by the end of the year. We can have open or almost open. I know they started construction on it, working on started
yes,
some construction on the land and so hopefully that's some big things that's coming in 2021 and we definitely look forward to it as we close out 2020 and
that's
CareSouth Carolina podcast for 2020. All right,
right.
for
Yep,
this year. And
that's right.
but we
Happy
want
New
to
Year.
thank everybody that tuned in. Right, we want to thank everybody that tuned in,
Yes,
everybody that came on and supported the podcast. Those our guests that came on and shared their information and their story. We just want to thank you for a wonderful first. I want to call it a first year. It hadn't been quite a year, but we're gonna call it first year of the podcast as we go into 2021. Also thanking our executive management team, including our CEO, for allowing us to have this platform and believing in
yes,
us when we
yes,
pitched that idea. They said, "Go for it. Let's see what you got." And they've been in support of it ever since. Same with our families and our friends as well.
yes, yes. Yeah, Marek, I enjoyed it. I can say it's been a year because everything kind of doubled in 2020.
Yeah,
So we might have been on for 6 months, but it seemed like we've been on a whole year because
yeah, I
it's
know.
been that it's been just like that. So, but we really look forward to a brighter side of things in 2021. We really do.
All right. So shout out to Care South Carolina, Care South Carolina staff, MAT SUD staff, community health staff, all Care South Carolina staff, and our community partners as well as the community that we serve, our service area, entire state of South Carolina, and we look forward to seeing y'all again in 2020 next Friday, 2021.
Yes, yes,
New things,
yeah.
big things. Thank you again. And you got any last words you want to hit? Shout out to the people and say before we close out.
No, just remember to be safe. Enjoy your family, protect your friends, and Happy New Year.
That's it. Happy New Year. Simple as that. All right.
That's it.